In addition to parents opting out of vaccinations for children, a report released today from the American Academy of Pediatrics says another dangerous trend is also on the rise. Many pediatricians are now being asked to spread out the recommended vaccine schedule, and doctors at Cincinnati Children's Hospital say this is not a good idea. Medical reporter Liz Bonus explains why.
The vaccination schedule for children is generally set up around well-child checks. That way, kids get what's needed for protection, and parents aren't running to the doctor's office more often than needed. Dr. Robert Frank is a pediatric infectious disease specialist. He says research shows it is safe to give multiple vaccines on this schedule at each visit. If a new one is added to the schedule, it too is tested alongside the others.
And so we know that before the vaccine has ever been licensed that it's okay to give with the other vaccines.
But according to this report just released, nearly 9 out of 10 pediatricians have recently been asked, especially when parents have kids not yet 2, to spread out the vaccine schedule. Most said they were concerned about side effects not supported by research, such as autism or an overload to the body's immune system.
So if a parent has concerns, though, about giving multiple shots at one time, what's the harm in spacing those out?
Our immune system can handle tons of antigens at one time. So really there's no science to show that the vaccines overload the immune system.
Antigens are substances that produce an immune response in the body. Dr. Frank points out that while we know which vaccines are safe to give together,
we don't know what's going to happen if we split the vaccines and just people give them at different times.
Dr. Frank says that research also shows most often when kids don't follow the schedule recommended, they won't finish the vaccines. That puts not only those children but others at risk for childhood diseases.
When it comes to spacing that goes in contradiction to the CDC, the FDA, the American Academy of Pediatrics, you think what?
When it comes to spacing of vaccines, different from what the FDA, the CDC, or the AAP would recommend, there's no data to suggest that it's necessary or a good thing to do.
At Cincinnati Children's Hospital, Liz Bonus, Local 12 News.
Now, most of the pediatricians surveyed in this report said they did not try to explain to parents why the schedule is important, but many said that they went out of their way to accommodate parents' wishes and tried to build trust and understanding along the way.